Let's talk to Dr. Layla McCay, who's director at the NHS Confederation. Good morning to you, Layla.
Good morning.
Obviously, we've watched this happen on the continent. We've seen this again and again, hence we've got all these 14-day quarantine rules in. How concerned are you about this, and how concerned is the NHS Confederation?
I mean, NHS leaders are really concerned about what the winter is going to bring, and I think that when we see a rise like this in the number of cases, it gives us a little insight into where trends might be going. If we see, as we have done in other countries like Spain, it starts small, but then it really starts to rise quite significantly. It starts with younger people, but then it spreads to older people, and the more severe consequences become increasingly apparent. We're seeing that in other countries, and when we see a rise like this, we start to worry that that's the sort of thing that could be coming this way.
And that's the concern, isn't it? I mean, I have to say, when I've been looking at the numbers, what's been going on in France, in Spain, and across the continent, it has been undoubtedly, we know about more of these cases simply because we are doing more testing. It may well be the case that back in March and April, if we'd carried on with testing or had testing anything close to this scale, I mean, it's been a huge increase in the expansion of testing, we may well have had these sort of numbers then, bearing in mind most of these people are young people. They often have no or barely any symptoms. It may well be that we are simply testing more and we're seeing more of these cases, and we've had this sort of level before, but we just didn't know about it. In which case, isn't it just more information rather than anything more to be worried about? Or is that too simplistic?
I mean, undoubtedly, the amount of testing that you do will affect the amount of positive results you get when the virus is circulating. But at the same time, we really need to look at the trends here. If the proportion of people being tested is staying fairly stable, then you have a feel as to what's going to happen. When the numbers start to rise, and not just rise a little bit, but really rise with an increasingly steep curve, you start to think, my goodness, it could just be a blip, but it also could be a rise that we could see continue along that trajectory and become what we would be obliged to call another peak or another spike. And whether that would happen in a local way or a national way, I mean, we just don't know.
I mean, and that's the thing, isn't it? We don't know, and that is the very big concern, is the not knowing. In terms of seeing extra hospitalisation, seeing extra deaths, we know that virtually everybody who caught the disease early on and died in the early stages of this pandemic, they caught it in hospital. They were catching it in care homes, in hospitals, and it was vulnerable, elderly people who were dying. Your chances, even if you're in your 80s, if you catch this virus, of dying, I mean, you still got like some 90% chance of being alive. I mean, these are still not great odds, but they're a darn sight better than perhaps most people have an idea of. There's this idea that if you're over 70 and you leave the house, you catch the virus, you're a goner. It is completely incorrect. We also know that treatments have got better. We know so much more, and people are surviving and getting less serious symptoms. Given that we know that you come out of lockdown, kids go back to school, particularly young people going back to university as well, we are going to be seeing an increase in infections. It would be strange if we didn't. If we can keep on top of it with lots of testing, with lots of quarantining and local lockdowns where there is outbreaks, is there any reason to expect a second wave that would be something similar to what we saw in March and April?
Again, we just don't know. Being able to keep on top of a rising number of cases is very strongly contingent on having a really excellent test, trace and isolate system in place. As we know, we do have a test and trace system that is working, but the question continues to be, is it actually working well enough? Every time we see the figures, we feel concerned that we don't have the reassurance that when somebody tests positive, they are immediately transferred to the system, they are immediately tracking down all the possible close contacts, getting in touch with them and discussing with them whether they ought to isolate and then whether that isolation is happening. We don't really have that reassurance, and I think it's something that the NHS would very much like to see a bit clearer in order to have that reassurance themselves.
Just one final question related to what's been the effect on NHS care with coronavirus is the huge backlog in treatments for cancer and anything else, any sort of elective surgery or routine surgery as opposed to anything in emergency. We got a rule that by end of October, or maybe it's even the beginning of October, the NHS hospitals have to get back to 90% capacity. We know many of them are operating far, far, far below that. Long waiting lists, some 10 million people waiting for various treatments by the end of next year, we're told. How close do you think most hospitals can get to that 90% capacity?
We're increasingly hearing from our members that they are very concerned that this target has been set without enough discussion about the extent to which it's possible. They're working incredibly hard to make this happen, to bring back all these services. But we need to remember that they're working in a different place than they were back earlier in the year. They have to implement all these extra infection control regimes, which significantly reduces productivity. They have not quite enough staff compared to what they might need to achieve this. They have staff who are exhausted, who are burnt out, who need holidays. All of that, again, reduces the amount of speed that they're able to bring these services back. And at the same time, as we've just discussed, it is possible that there's going to be a huge surge in coronavirus cases. Hopefully not, but while we hope for the best, I think that everybody is relying on the NHS to also be prepared for the worst, and to do that responsibly. It means managing that capacity. So it's going to be really tricky for every single hospital, every single surgery, all the various types of care across the NHS to be back up and running at an extremely high amount when they have all these other challenges that they have to deal with at the same time.
Dr. Layla McCay, thank you.